strategy document, outcome document, which was published a few years ago, and hence the name itself kind of is clear itself that there is no, you cannot have any physical well-being or anything else. You cannot practice your devotional service well if you do not look after your mental health as well. So I was wondering, in the next few minutes, it's not possible to go over the whole, as you can imagine, the length and breadth of the mental health, but just to divide my talk, I thought I'll talk about some of the statistics why, which is kind of an eye-opener, because we kind of tend to think that mental health only affects people from an alien world. It doesn't help or affect any of us or our families, but that's not the case. And then moving on from the statistics, I would focus a little bit more on the interface between spirituality and mental health, though Dr. Malab has already touched upon that topic. Then I'll give you a little bit about how mental health is being designed under the BNA umbrella, and then talking about the scope of the service itself, and then give you a little few resources, useful resources. If you want, you can click some pictures of that, or you can come and talk to us next door, and we can give you some pointers and some leaflets to take away. Yeah. So, up there it says that at least 1 in 4 people will, at any time, they have a mental health problem in their lives, and 1 in 6 people would have a mental health issue at any given time. So that itself, kind of indicates that, from between, young childhood to adulthood to old age, at some point of time, every, imagine 1 in 4 people or every 4th person in this world would have a mental health issue. And 1 in 10 children between the ages of 5 and 16, they have mental health issues. And some of them, many of them actually continue into adulthood. Some of them burn out, especially ADHD, that tends to get better in many of them, but many kids with ADHD, they tend to have ADHD into their adulthood as well. There are lots of children that we are seeing these days who are self-harming, especially among the teenage groups, and that also needs addressing at an early age. I can't see my own slides right at the back. I think Dr. Malab did a good job. You brought your cards with you, but I didn't realize it would be that high up. But anyway, I think the last point in the slide, I can't see it very well, but I think it says that about 3.25 million people, they access mental health, learning disability and autism services within the NHS in the year 21-22. So that itself kind of tells you the majority of the need of mental health, which is there. Now, this is again a part of the report that, part of this document which was published by the government. And in this one, it says about the foresight report on mental well-being. If you look at the indicators which they take, connect, like connect means to be, connected to your friends, your family, your neighbors. Be active, active means to look after your physical health so that you're able to look after your mental health. Take notice. Take notice means being curious as to what's happening, not just with ourselves, but actually with our friends and family. Keep learning, always be inquisitive, never, as Srila Prabhupada says, keep, always have a desire to learn new things, read regularly, and then also to give. In this document they say give means to serve, as we say in our own communities, to be, in that mode of service. So if you look at all these 5 things, those Prabhupada's, it almost seems as if they have taken these 5 from Prabhupada's vision as well, what he wanted us to be in our communities. So being in our communities actually helps us to achieve all of these 5 if we are actually associating with our, devotee community. But at the same time, we have to do this actively, remain, be grateful for what we have, and, look for the opportunities to be somewhere in the circles, be noticed, serve in the background, be connected. Don't, kind of suffer in isolation, but somehow or the other, talk about your problems. And I think that is the key. Learn, have mentors if possible. So So then that brings us to the interface, is spirituality, we are supposed to be a spiritual society. So if we are a spiritual society, that is kind of, what you say, like a protector or a shield that we should have. Then people within the spiritual society should not have mental health issues. But do we have mental health issues? Can we have mental health issues? The answer is yes, we can have mental health issues. The reason is, mental health issues, sorry, I've jumped a slide. Mental health issues, they are like any other mental conditions. They affect a part of the body which is the brain. The brain has got, neurotransmitters, it has chemicals, it can be chemical imbalances. Sometimes even the physical health problems which are very treatable. For example, somebody has got hypothyroidism. That can, the thyroid gland is not working properly, but that can present with somebody with depression. So if you look after those things, if you seek help, so those things are very treatable. Like lots of people have this myth that, it is a reflection as if I am not, steadfast or disciplined in my sadhana. It's kind of seen as a sign of weakness that what if I have a mental illness? But that is definitely not the case. Like lots of people, to give an example, lots of people who don't eat meat can still get colon cancers. Lots of people who don't smoke, they can still end up having lung cancers. So lots of people who are actually associated with spirituality or within the ISKCON community, we can also be, vulnerable to developing mental illnesses. But the good thing is, mental illnesses, even if they are not curative, as we shall we say, there are some episodes which happen as a one-off, and the person might never have a problem again. A common example is people, especially with ladies, we see postnatal depression, and they might just have postnatal depression which is limited to that sort of a phase. And many of the ladies, they never might have depression again in life, but many of them also have depression which follows on. So everyone varies, but having said that, most mental illnesses, in my experience, they are very much treatable even if they are not curable. So the idea is, if you look after your mental health, you are able to live good, fulfilling lives, and with the right sort of help, you are able to come to terms as to the challenges those mental illnesses bring, and that doesn't stop you from doing your sadhana, it doesn't stop you from serving your spiritual master and leading very fulfilling lives. So the take-home message is, don't ignore your mental health, don't be ashamed of asking for help. So bringing on to the next topic, then what is it that we are offering within the BMA under the mental health window? It's under Sundaranandan Prabhu's guidance, we've developed a two-tier service. The first tier of the service is called Karuna Care. This is led by one of Prabhupada's disciples, Ram Guru Madhavi. She's based in Australia. And she's got a big team that she's trained over these years. There are about 20 people there in Australia, and there are the rest. Some of them are also practicing in the UK. So if you contact her, I'll come on to how the referrals can be made. So this is essentially an online consultation platform. So the scope, I'll come on to Karuna Care in a minute. So the scope of the service is, that we are doing these second opinion consultations. It is, it's more or less to give direction if you are struggling, because when people have got mental health, they sometimes do not know whom to approach, what to do. So it is not a crisis service if somebody has got a mental health crisis, they're feeling suicidal or they're feeling homicidal. So that is beyond the scope of our service, simply because of the resources that we have, and also the indemnity that we have from a professional indemnity that doesn't cover us from doing the length and breadth of that. And we would by no means claim that we are trying to replace the NHS mental health services, because that is a very big service, and with our limited resources and level of expertise, we cannot match them. But nevertheless, we are able to give direction if somebody is desperate. We are not a prescribing service, but if somebody is already on medication and they're suffering from side effects and they need a second opinion as to what we do, we can give you some direction. Okay, you can ask your own practitioner, own psychiatrist or own GP. These are the things to look out for. Maybe you can trial this, trial that. So that is the, the direction that we want to take. Again, we are not able to offer long ADHD assessments or autism assessments simply because our indemnities don't cover them, and also the length of time that they take. It's almost 4 or 5 hours for each consultation to do justice to the job, and also we are not able to do any medico-legal consultations because lots of people, they come to us, I have had a problem at work, or I have hit somebody on the road and I might think I have got ADHD, can you help out? So those kind of medico-legal things are beyond the remit of our consultation. But other than that, we are kind of flexible. Even if we do not have the resources ourselves, through our contacts, we would be able to help you to the best, possible level. These consultations are essentially supposed to be for about 30 minutes to an hour with the psychiatrist. The psychologists, we have got 6 psychiatrists in total signed up. All of us are spread out, 2 of us are here. I am doing this from Birmingham. There is another senior disciple of Radhanath Maharaj, Deembandhu Prabhu, some of you might already know him. Otherwise his name is Dr. Deepak Gupta. He is a general adult consultant. And there are 4 other psychiatrists, one in India, 2 in Australia, 1 in the North America. So all of us, we have a rota that we run and on a weekly basis. So if there are any referrals that we can pick up, or whosoever is best suited for the person, or then we can offer that. Then the first year is, as I mentioned earlier, first year is through Karuna Care. That is, you send us a referral. They offer, compassionate listening, bereavement, counseling, emotional support, spiritual care. If there are those kind of issues that have to be first dealt with, then they are the first level that people contact. If that is something that they are not able to deal with themselves, or if they feel that the need is more psychiatric based, then they send the referral across to us. If people are anyway clear that they do not want Karuna Care and they would rather speak to a psychiatrist, then you can put it as a request on the referral forms as well. We usually get a disclaimer and a consent form signed as to what we can or we cannot offer. My husband always calls me the wrong today is no different. And we have also got 3 psychologists as well who are attached to our service, who are willing to offer their time. The way they have agreed is that they will be able to offer a one-off free consultation, and then if there is a further need for a short-term or a long-term piece of work, which would be extended over a few months to sometimes even to up to a year or something. So that is something that you would have to negotiate the price with them. You can pay them, and the BMA doesn't take responsibility directly with them, but that is something to be, you can negotiate with them. So all the referrals, if anyone wants to have a picture, you can take this, or there are some cards available. So this is the Karuna Care website that you can send referrals across to. And if, as I said, if needed, then they can send the referrals across to us. So these are some of the really useful resources which I have pulled out. These are charities, for people who they are based in London, called the Brandon Centre. This is a service for counseling and psychotherapy for young people. So if you go onto their website, you would be able to see some useful resources there. There is another place which I can't read, but possibly you might, called the Cooth Centre, which is also which is a charity for kids, offering psychotherapy and emotional support and well-being support. And the last thing is the IAP services, or it is the increased access to psychotherapy services, which is a self-referral service for adults. You can either do a self-referral, or you can also have your GPs to do this referral upon talking to your GPs if needed. They are usually able to offer about 8 sessions. And they are a first-line generic service, but they usually practice what is cognitive behavioral therapy, or CBT for short, which many people might be familiar with. So that is usually the model that they follow. Then I pulled up some resources for autism and ADHD as well. Some of you may or may not be aware, when people have got a diagnosis of confirmed diagnosis of autism, then government actually gives you this access to work funding which is available. So that helps with, if you're struggling to go to work, if you're struggling to go to an interview, and so there are some funds available where you can be accompanied or you can be given some resources for the diagnosis. Also, within your right, if you're diagnosed, that you should have reasonable adjustments made at work, as well as at many of the universities are also signed up for that. They make you reasonable adjustments so that a person is able to function to the best of their capabilities. That might entail, giving you a desk or something or other, paraphernalia made available to you. Then you can also avail from the Citizens Advice Bureau. There is a National Autistic Society, ADHD charity and stuff. And this is my last slide. There are some charities which you can access if somebody is having suicidal thoughts. If you want, you can take a picture of that if needed, or you can contact the GP. If there are any questions, I am next door. I've also got a colleague and a friend of mine, Dr. Sangha, who's kindly come with me today. She's also a working age general adult psychiatrist. So, Hare Krishna.